Good afternoon, everyone. I'd like to thank the organizers, certainly Robert and Carla. Everything has been very lovely. We really appreciate the invitation. Speaking from the Health Disparities Research Center of Excellence at Meharry Medical College. And so I'd like to take you on a small journey today. And this is just a brief outline of what I'd like to discuss with you very quickly in the time that we have. So I'd like to begin by talking a little bit about the wealth gap to put things into perspective. And of course, based on the excellent talks this morning, talk a little bit about place. And we've had excellent introductory talks from the director, of course, and Robert and Dr. Ortiz. Thank you very much. And a lot of this serves as excellent pre-information for some of the things that I'd like to talk about. So things will go as such, but mainly I'd like to share with you some of the ethnic communities and the environmental justice work that we are doing in those ethnic communities around Columbus. We call it the Southern Gateway, and show you some of the socio-demographic and health profiles, of course, and we've made a lot about community engagement. We talked a lot about that today, so I'd like to share with you some of our transformative community engagement models and some of the results therein. And mainly, I'd like to sort of introduce you to the public health exposome framework. This is the ecto exposome as opposed to the endo exposome, which is why we coined public health exposome in front of our social ecological life course paradigm, okay? And we have analytics, big data to knowledge analytics to complement that framework. As well, we have structured several collaborations, but mainly we have one big functional stakeholder group, if you will, there in Columbus, and I'd like to share with you some of our results, some of our findings, and some of the modalities that we use to engage African American or minority-facing communities, if you will. And then end up talking a little bit about preterm birth and low birth weight because, of course, Columbus has distinguished itself once again as one of the leaders in infant mortality. And of course, prerequisite to that would be low birth weight, preterm births, and other adverse pregnancy outcomes. And end up talking a little bit about opportunities and in scaling of our framework, okay? And so within that context here is, and you can't really see this, here we're looking at life expectancies, okay? In the cities across this nation. And what you find is that in Columbus, for an example, there's a 27-year deficit in life expectancy via census tract where you're born, okay? That's pathetic. That tends to suggest that we in Columbus have significant issues, and it suggests that we have several environmental justice communities, if you will. And so, whoops, oh, don't go back, Darryl. Let's see here, backwards. Can you take it back one time for me? Which button is it? You can just tell me. Oh, yeah. Okay, I got it. Yeah, I got it. Thank you. The point is what I was trying to use right here. And as you can see here, that's Columbus. And so if you look at highest and lowest median income, look at that wealth gap, okay? Several tens of millions of dollars. And that's just, we aren't gonna tolerate that, if you will. So this data is a little bit old. Population, of course, and the 2015 is over here. But you're looking at life expectancy by birth, okay? And by metro area. And so we're not proud of this. This is something that we will work on. And so, yes, Mayor Coleman, when I came to Ohio State from Meharry Medical College in 2013, there was significant problems in this area that was slated for renovation called the Southern Gateway. And this is the sort of the focus area that he wanted to begin with over here. 7 ethnic communities, okay, slated for renovation. When they say renovation, what's that the code word for? Gentrification, right, okay? And so there were a number of assets though. And one of the communities wrote the dean of my college at the time, and which is Bill Martin, one of your predecessors, director. He was associate director in our EHS. And this is the letter that they wrote. Now, this letter was all-inclusive, of course, but one of the things that this demonstrates is that first and foremost, we have an operational, functional relationship with the public health department, as well as the Ohio Health Department, state, as well as the Ohio EPA, okay? And so as you can see here, they wanted me to do some studies there. We did them. They were hazard assessments, okay? And I'll just like to run through some of those with you. But heretofore, and what this demonstrates is that Columbus, not unlike many other communities across the United States, has a significant problem. And of course, place does matter with respect to, Place does matter with respect to healthcare disparities and disparate health outcomes, okay? And, okay, sorry. Oh, it came back. One back, please. Back, please. Yeah, okay, yeah, this is what I want you to consider for a moment, if you will, in terms of where we live, work, play, and pray. And it is in this complex network, back again, please, sorry about that, yes. One more time. Yes, this isn't working for me because I have a big thumb. Oh, okay, gotcha, yeah. There we go. So consider for a moment, if you will, this complex network of individuals where we all live, work, play, and pray, right? And within that particular environment is encompassed by the built policy, social, natural, and physical environment, okay? So this complex network is indicated by nodes, right? Nodes in a network. And it then sort of sets us up for whether or not we are exposed to either chemical or non-chemical stressors, as shown here, okay? Now, we've heard all of this so far today. Omics, disparate health outcomes. We've heard about behaviors, yes. But what you haven't heard about is our extended exposome framework, which has these big data to knowledge analytics. And we've looked at this, used our framework to look at population level disparities in cardiovascular disease, diabetes, cancer, low birth weight, preterm birth, not really infant mortality yet, okay? And developmental learning, okay? As you'll see here shortly. Yes, social demographic indicators, you've seen them all. This is no different. Here we have population. Whoops, yep. We're looking at population here. Yep. Oops, it won't do right. Yeah, there we go. Population, education, employment, health insurance, pregnancy and birth outcomes, health promotion, STDs, leading causes of death. All of these are chronic disease indicators. And look at what I have marked here. Zip codes versus Franklin County, Columbus, and Ohio. In either case, you pick it. you'll see that those zip codes, 43206, 7, and 9, are indicated by the number that you see there, which is statistically significantly increased over Franklin County, Columbus, Ohio. That's just deplorable. I have these here to remind me to tell you something a little later on. The new low-hanging fruit in terms of opportunities. And this is the east side, the near east side of Columbus as well, okay? Same scenario, the same scenario, no matter where you look. Unemployment, why are we looking here, the near east side? Unemployment is high, low birth weight, preterm births, out the charts, a lot of teenage mothers, and of course the infant mortality rate, which I've indicated to you. Chronic disease is off the chart as well. And so I think this morning we were also talking about sensors, yeah, And so Columbus is a purple city, a clean city, purple sensor city, okay? It has purple air network sensors everywhere. North side, west side, near east side, which is blown up here. What do you see? Nothing. Terrible, okay? So one of our grants we proposed to, we are about to get the award letter. We're going to put some sensors here in this area. All the near east side. So imputation, no, doesn't work. We at OSU, we have sensors and we put them there. Some of them, and there's a disconnect. So we're going to put a system of sensors in this area. Community engagement. Okay, so can I have some water, please? Yeah. So this is one of our meetings. At the Near East Side. In Columbus, the Ohio State University has really been very aggressive in terms of interfacing with the community. And so when I got there, one of the first things that my chairman had me do was to go over and give me an office at the African American Community Extension Center, which is shown here. And so, you know, as you can see, the first meetings that we interface with the community, with their community advisory board, you can see them here. You know, packed house always. One of the things that you have to remember is that you can't sort of negotiate from on high. And so we went over there and engaged them in a series of meetings using my graduate students' new paradigm called E6. And E6 is enriching environmental endeavors via equity, education, and empowerment, okay? And her enhanced transformative community engagement models, you know, follow the following. So if you recall, we went into COVID on or about the 1st of 2020. And so during November, December, January, February, we had 5 community meetings over in this area. And as a result of those community meetings, we were able to actually put together this functional stakeholder coalition, which consists of these particular agencies here. And as you can see here, we have us, we have us, one more. We have us shown here in the College of Public Health. We have the College of Nursing, which has its own center for youth, children, and women. We have a fairly qualified health center, okay, primary one. This is the community center, fairly qualified as it is, that the agencies, that the individuals in the community and the residents trust. CareSource is the major Medicare provider in Ohio, with the recidivism rate with respect to incarceration, and with the men primarily coming home. And of course, they're staying with their girlfriends who live in Section 8 housing and in the Mount Vernon area, which is where we are. Of course, they want to be a partner. You know, they're all in. All of these, you can't have a stakeholder that doesn't have a stake in the community in which you serve, okay? St. Vincent Family Center, as you see there. They are the primary caretaker for Medicaid, okay? Well, sorry, not Medicaid, for mental health via Medicaid, okay? So St. Vincent's Family Center, right here. Oh, no, not that one. Sorry, one too soon. Yes, and then we have Columbus Early Learning Center, okay? They are right there. They are the principal keeper of the K4, K5 individuals, the kids. And so I don't know if you all know or not, but COVID has caused a significant diminution in reading and math scores amongst kids who go to daycares in low census tract areas. Well, they've agreed to work with us. One of my graduate students, her dissertation project is looking at the COVID-19 slide, if you will, okay? And then, of course, we have Moms to Be, of course, as it says, pregnant women, services for them. Celebrate One is Columbus's infant mortality program. And then, of course, we have Meharry Medical College. I spent 20 years at Meharry prior to coming to the Ohio State University. My compadre right there, Dr. Paul Juarez, finally let me go. And then we have the Ohio Department of Health and the Franklin County Health Department. All of this is towards devising strategies, mitigation strategies, and interventions toward lowering our pathetic infant mortality rate, as you see here, preterm birth. Okay? All right, now, so how do you start that? We had some discussion earlier. You go into these communities and you try to begin a discussion, but what does this discussion need to start with? The community, as the director said this morning, and as you did too, Robert, as well as you, David, you all alluded to the fact that the community has to tell you their story. So this is storytelling. And this is one of these exercises that all of us use in our faculty retreats. I'm sure you all have done the same thing. You take stickers and sort of put them in the concentric circles where you feel it's experiential. Okay, and so we have discussions about that. That's the most interesting part of the meetings. We call it Voices from the Community. Okay, and so this works very, very nicely. As you see here, we have several sessions. There's one tonight, which I have to go run and go to, the 19th to 26th, and the 9th. Now, these are for the purposes of getting the community more interested in energy and transportation transitions. There's a lot of money coming down from DOE, DOT, and NREL right now. So, of course, we have been giving those webinars, maybe some of you have been on them, to how that money is going to be expended. And so, yes, they were primarily concerned about infant mortality in their area. We've heard a lot today about all of these different stressors, of course, and the maternal health conditions, and gestational diabetes is prominent, maternal obesity, hypertension, of course, and preeclampsia as well. But it all ends with, mechanistically, in adult onset disease in some shape, form, or fashion. And so when you look at Stanbaugh Elwood, it is just, that's it right there. The little concentric circles, those are zip codes. And it's surrounded by 13 toxic release inventory facilities. Now that in and of itself isn't bad. However, it isn't good, right? And so what are some of these emissions? Yes, the EPA, we pay the EPA to pollute. Yes, we have to. You know, we're a civilized society, I thought. But in the long run, we ended up doing several hazard assessments for the community. This company A that you see right there in the middle, and this is some of the citizen science, public participatory geographical information systems work that we have to be about doing at the National Institutes of Environmental Health Sciences going forward. You have to do this work. The community knows what's best, but they need guidance. They need educational programs and literacy and so forth and so on, okay? That company A right there, guess what they ended up doing? Packing up and coming back to New York. Now, it used to be called Buckeye Steel, you know, all of the EPA's air dispersion modeling and all of our work sampling, just simply soil sampling in the area, resulted in us quantifying that load. Here's just some examples of how we did this. And, you know, to make a long story short, if you look at the residential soil sampling level of the US EPA, you see it right there, that dotted line. Maybe all of these 28, 23, 24 residences weren't above it, but you know, if it walks like a duck, quacks like a duck, then, you know, they're vulnerable. You know, the EJ screen indicated there was significant vulnerability here, as well as does the Public Health Exposome 5.0 construct. And then, of course, we provide them. We heard from the last speaker, or the speaker before, Dr. Ortiz, I think, was talking about the importance of risk community. That was you, Robert, yeah. The communication of risk, the proper communication of risk. And while we had the modules, environmental literacy modules in our PPGIS system, which is a Mapler portal, you have to be very, very careful. And they were instructed what to do next by either myself or my boss, okay? And so this is just an example of our public participatory geographic information system portal. You can see there, it's based on the Health Opportunity Index that we coined recently. My last master's student got that done in 2020, right before the pandemic, I think. And so it's, you know, based on 13 variables, not just one, right? Okay, so social vulnerability index tells you a lot, but the Health Opportunity Index tells you a little bit more about where people are that need help and that are vulnerable, particularly with respect to a global syndemic, right? And we have different labels here. You can see we monitor PM 2.5. Dr. Al Hampton on our team is used to be employed at NASA in Huntsville for, what, Paul, 20 years or so? And now he's at the University of Mississippi leading a center. But we have, that gives us the benefit of the MODIS satellite, where we can take the 3-kilometer gridded data and link it to our public health exposome data set. And so the director went through this morning. This is the depiction of the social ecological life course framework that we use, and I'm using it currently in those communities that you see down to the lower right there. Paul will tell you a little bit more about that during his talk. And so, yes, we think that we now have a way to interrogate hypotheses at the individual, community, and population levels. Notice how that theme keeps arising from all of the talks that we've heard today. However, we use a different big data to knowledge tool chain, if you will. Supervised and unsupervised clustering methodologies and paraclique analysis are big in our arena, okay? As well as pairwise and non-pairwise associations. And we can give you examples. You just have to Google myself or Paul, and check that out, okay? But the beauty of the Public Health Exposome, as we have curated it, is that it's both spatially and temporally aligned. And we did this using the Southern Cohort Community Study, okay? So as you can see here, many of those variables in the Public Health Exposome, there are 50,000 so far, Paul tells me. I use 25,000 of them. I only need 25,000 to do what I need to do. And you will note that they are in alignment with the social determinants of health, right? Okay, and so as you can see here, that I think they're on their fourth wave right now. And yes, that's why I thought I'd look over there. Yeah, and so here's just some more information with respect to the 3-kilometer grid being linked to the Public Health Exposome 4.0 data set. We are clearly in a position now where we can interrogate hypotheses in a manner such as we'll be able to understand better the exposome within the context of health disparities. We have all this data, primary data, secondary data. This is one of our key chains here. Dense subgraphs is what we like. We like dense subgraphs and how they are able to allow us to move into this realm of, and this is just a Bayesian network, just showing you how we can model the complexity of relationships. All 88 counties in Ohio here, and yes, preterm birth and low birth weight was linked to many of these socio-demographic and environmental variables. These are paracletes. Paracletes are sets of related nodes in a network, and this is the future. This is where we want to end, and I'll be happy to talk with you, any one of you, in a different setting. But if you remember anything, remember that paraclete analysis is the future. We heard a lot about resilience, right? And so we're using severity scoring to sort of, follow trajectories, because this is what you want to do in communities like the communities that we work in. You see that opposite ordinate there, differential risk trajectories, and it's very, very predictive. We're on our way. And so, who said something about maps earlier? Well, this is an exposome map, okay? And what it did was this is us scaling the exposome to identify multiple determinants with respect to, that were responsible for the increased incidence of Zika down in Brazil. This is Patricia Cifuentes, one of my postdocs. And we had control networks, sub-networks of all births versus low birth weight. And then all of those lines that you see are, of course, partial correlation coefficients or higher order coefficients. And I'll stop right there. To see this here, you have to invite me to your school so I can tell you a little bit more about it. Okay? This is very interesting. Thank you very much. The future is social sensitive. This is my group. Thank you very much.